Innovations in Gynecologic Cancer Care. Dr. Megan Hutchcraft's Approach. July 29, 2025. By Beth Hart. In the realm of gynecologic cancer care, Dr. Megan Hutchcraft from Carle, Illinois College of Medicine is at the forefront of innovation, revolutionizing the methods by which these intricate diseases are identified, treated, and ultimately prevented. As a professor at CI Med, she seamlessly blends advanced research with empathetic clinical practice, aiming to alleviate the impact of cancers that affect the female reproductive system. As a practicing gynecologic oncologist at Carle Health and a committed mentor to medical students at CI Med, Hutchcraft is not only influencing scientific advancements, but also shaping the next generation of physicians. Her focus lies in cancer risk reduction, actively engaging patients with established prevention strategies, and training medical students to become not just skilled clinicians, but also innovative physicians dedicated to making a significant difference. Gynecologic oncology is a truly unique field, where I have the opportunity to connect with patients during their most vulnerable moments, she expressed. Hutchcraft's extensive knowledge allows her to provide reliable, evidence-based information. Many individuals perceive cancer as a death sentence. The mere mention of the C word can be terrifying. One of my responsibilities is to educate people about the natural progression of cancer. I aim to be their guide, helping them navigate through their cancer journey, from diagnosis to treatment, and throughout their lives, she explained. Over the past few decades, we have achieved remarkable advancements in research, leading to the development of medications that could potentially transform the outlook for patients who once faced a drastically shortened lifespan into those who might be cured. Sharing this information with patients is not only uplifting, but also crucially accurate, is pivotal in enhancing care for patients with hereditary predispositions to reproductive system cancers, including those affecting the ovaries, fallopian tubes, uterus, and cervix. Research has shown that individuals with specific genetic mutations associated with other cancers, such as breast, colorectal, and pancreatic cancers, are also at an increased risk for developing reproductive system cancers. Consequently, many of these high-risk patients opt for preventive surgeries to mitigate their risk. To shed light on how this preventive strategy is implemented in clinical practice, Hutchcraft collaborated with several CI Med students on a new research initiative. Student Sanskruti Priya Guduri noted that the project aims to gather data on the application of risk-reducing salpingo-oophorectomy, which involves the removal of both fallopian tubes and ovaries to lower the risk of gynecological cancer among specific at-risk populations. This is an incredibly exciting project with significant implications. If we can identify trends in the care of patients with these genetic mutations, we will be able to make substantial recommendations on how to adhere to the guidelines for their gynecological care, Guduri stated. Although the study is still in its initial phases, Hutchcraft is optimistic about achieving better outcomes for at-risk patients. The potential impact of this research is that it could provide valuable insights to general gynecologists and gynecologic oncologists like myself on how we can enhance our practices, ensuring that we adhere to the surgical and pathological recommendations for patients at extremely high risk for cancer, she remarked. The importance of prevention. On a broader scale, Hutchcraft advocates for routine genetic testing for all cancer patients as a means to decrease the incidence of newly diagnosed gynecologic cancers each year. Germline genetic testing, which involves blood tests to identify genetic mutations, may uncover hereditary risk factors for cancers that have previously gone undetected. We need to identify these patients and provide them with preventive services to help them avoid new cancers. Whether through vaccinations against human papillomavirus or ensuring they are current with their cancer screenings. Additionally, cascade testing for their family members could significantly reduce the overall cancer burden if implemented effectively, she explained. Hutchcraft actively promotes the message of prevention through social media platforms such as X, formerly Twitter, Instagram, and TikTok, aiming to connect with a younger audience. We might be overlooking a substantial group of young individuals who could be at risk for future cancers, or who have family members that are. It's essential that they receive accurate information on these platforms. There is a lot of misinformation circulating, and as physicians, we should leverage these platforms to empower patients and their families to make informed decisions, Hutchcraft emphasized. Nurturing future research clinicians. With her dual role as a physician and surgeon, coupled with a robust research background, Hutchcraft is exceptionally positioned to foster medical research by mentoring CI Med students, who are poised to become future leaders in obstetrics and gynecology. Research is the engine that propels medicine forward. It's how we have made strides in curing cancer, and it's an exhilarating field to be involved in. Medical school is an ideal time to engage with research, as students are eager to learn about the various aspects of medicine, she noted. CI Med's Clinical Research Mentor Program encourages collaborations between students and clinical faculty based on shared interests. Their collective efforts have led to groundbreaking research published in prestigious professional journals. Gaduri shared that her close collaboration with Hutchcraft on the risk reduction research project has deepened her interest in gynecologic oncology and sharpened her research abilities. I initially decided to pursue OB/GYN later in my academic journey. Dr. Hutchcraft welcomed me and provided guidance on how to advance my career aspirations, she reflected. Another student, Amik Bindra, who entered CI Med with a background in data science, partnered with Hutchcraft during her first year to develop machine learning tools aimed at enhancing the diagnosis of endometrial cancer in younger women and women of color. CI Med is a wonderfully interdisciplinary program, and having clinical mentors like Dr. Hutchcraft has enabled us to integrate our diverse academic and technical backgrounds into practical clinical applications. It has shown me how my skills can be utilized in meaningful and impactful ways, Bindra remarked. Chapter note: for more information about CI Med's Clinical Research Mentor Program, please visit here, https://medicine.illinois.edu/clinical research mentors, or reach out to the Office of Student Research. At Carle Health, Dr. Megan Hutchcraft is associated with the Carle Cancer Institute and holds the position of Associate Director of the Carle Obstetrics and Gynecology Residency Program. This article was authored by Beth Hart, with video production by Virgil Ward and photography by Caden Rawson.